My name is Trish Ware, and I am obsessed with all things pregnancy and birth, and helping you to navigate both the practical and the magical seasons of this journey called motherhood. I'm an all-day coffee-sipping mama of 7 and labor and delivery nurse who took her expertise in the labor room and turned it into an online one-stop shop for mamas looking for powerful education and support. I've had the amazing privilege of delivering many babies in my 15-plus year career as a labor and delivery nurse and as a mama of 7. I'm here to help you take the guesswork out of childbirth so you can make the choices that are right for you and your baby and write the birth story of your dreams. So hit subscribe and let's replace your anxiety and fear with complete confidence. Quick note, this podcast is for educational purposes only and does not replace your medical advice. Check out our full disclaimer at the bottom of the show notes. We're going to talk about when your water breaks, what does it feel like? Because the questions I get are, what happens when my water breaks? What does it feel like? What does it look like? And what do I do when my water breaks? What if I am at home? Do I have to rush to the hospital? Or what if I'm not contracting? What do I do? So we're going to talk about all of this. This is going to be a quick little teaching topic. So stay till the end and we're going to just break it all down. For a lot of different mamas, your water breaking can feel completely different. So for some of my moms, they actually feel it. For a lot of my mamas, they hear it pop. That did not happen for me. I did not hear it. And it wasn't a gush. So when your water breaks, it can be a trickle, or it can be a gush, or it can be anywhere in between. If you've seen my reel about water breaking, you saw my surprise when it actually gushed. It can be a lot of different things. So when your water breaks, a lot of women say that they feel a relief of pressure. I personally didn't feel that either, so I don't know. Some people don't. When your water breaks, it can be very confusing because a lot of times you think what in the movies where it's just, oh, my water broke, and they know that it was their water. For the majority of us, it is not the case. We're left wondering, is that my water? Is that not my water? So what I teach my students and my mamas inside of my mama membership is that when you think your water broke, I want you to go and I want you to get a pad and you're going to put it on and then you're going to do some nice strong coughs and see if you feel leaking. So typically, if your water breaks, you're going to feel it leaking during contractions or during movements or when you do something like a big cough, or maybe when you're laying down and you sit up, or you're sitting down and you stand up. So a change in movement. It really depends also on the baby's head. So when the baby's head is down on the cervix nice and tight, you may not have as much fluid leaking. If you have a high leak at the top of your uterus, the top of your amniotic sac, you may have more of a trickle. So a lot of you guys are saying that you heard the pop. I never got to hear the pop. I have actually heard it when a patient's water has broken, which is very strange. But a lot of women hear a pop. Some of you won't, so don't feel bad if you didn't hear a pop. I never heard one myself. So when your water breaks, there's a couple things I want you to take away from today. One of the most important things is that you want to note the time. So if it's 9 o'clock at night, you're going to write down 9 o'clock at night. You also want to look at the color. So we're going to do the acronym C.O.A.T, C-O-A-T, color, odor, amount, and time. So the color of your amniotic fluid typically is a clearish pinkish color, and it looks like water. And sometimes you'll see streaks of white stuff. You might see streaks of blood. You might see what looks like discharge in it, but typically you're going to see that nice clearish pinkish color. If it comes out and it has a greenish or a brownish color, then there's a chance that the baby may have passed some meconium. If it comes out and it's predominantly blood, we don't want to see that either. So we're going to talk about what to do in just a second with that. So you're going to write down the color. Is it clear? Is it brown? Is it green? Is it red? Now, if it comes out and it is red, predominantly blood, then I want you to call the doctor on the way to the hospital. Don't stop. You're going to go to the hospital because we might have an emergent situation. It may be normal because you know how when blood mixes with water, it looks like a lot more blood. But we want to be the ones that really check that out and make sure you and baby are okay. If it comes out and it's greenish, brownish, murky, thick, then you're going to call your doctor, let them know, and then you're going to head to the hospital or do it at the same time. Call on the way. If it comes out and it's clear and it's pink, then girl, you do not have to rush to the hospital. We're going to talk about that in a minute. Now, the next thing for C.O.A.T is the odor. Typically, now I know the smell of amniotic fluid. When I was pregnant myself, I could tell if my patient's water broke off the bat. I knew if it was urine. I knew if it was amniotic fluid. If the fluid is coming out and it smells like urine, it's most likely urine because amniotic fluid has a distinct smell, but it's not a bad smell. It's just distinct. If you smell a bad odor, if it smells putrid or rank, then you're going to want to probably go into the hospital because you may have an infection. So that's another indication for going into the hospital. You're also going to note the amount. If you have a lot or a little, just write that down. And again, the time. So the T is time. Now, how do you tell the difference between amniotic fluid and going pee? There's a couple different ways. The first is plain old smell it. So this is why if you think your water broke, put a pad on. If you don't need a pad, then it's probably not your water. It may be a high leak, so we're not completely sure. But if you put a pad on and you take a nice big cough, or you get on your birth ball and do some little bounces or some fast figure eights, then more than likely, if it's your water that has broken, you're going to have fluid come out. And then you can just do an old-fashioned smell test. If it smells like urine, it's probably urine. If it doesn't, then it might be your water. Now, if you think your water broke and you get on the ball and you're coughing and you're moving around and nothing else is coming out, chances are it's not your fluid. But I still want you to have a pad on in case you have a nice slow leak that's going for a while. All right, again, we talked about the color and if you should go to the hospital if it's predominantly bloody or if it's green and murky or if it has a bad smell. Now, what's the opposite of that? If none of that's going on and it's just your water breaking, then you do not have to rush to the hospital unless you have an abnormal situation. If you have a high-risk diagnosis or your provider has specifically said in your circumstance, you need to come in. Now, a lot of providers will tell you if your water breaks, come in, but you really don't have to. Sometimes your water will break and you're not really in an established labor pattern. So what I teach my moms inside of my mama community, my mama membership, is that if your water breaks and your contractions have not started and you have none of the reasons that we've covered that you need to go in, then I want you to stay at home and wait for your labor pattern. If for some reason after 6 to 8 hours you still have not established a labor pattern, then you might need to come see us because we might need to help you get going. Sometimes your forebag might break. You actually have 2 layers that have to break, but you might need to come in and we might need to either break the other or get your labor started. So 6 to 8 hours, if labor contractions have not started, you want to consider going into the hospital or going into your birth center or wherever it is that you need to go. Now, a lot of times, mamas will be like, my doctor said I have to come right in. I'm going to tell you the best thing you can do is labor at home, as long as there's no medical reason or high-risk reason that you shouldn't. But always discuss whatever I'm telling you with your provider. Decisions should be made on an individual case based on your health history, on your OB history. Now, if you're GBS positive, because this is the next question I get all the time, what do I do if I'm GBS positive? So if you're GBS positive and you've chosen to be treated with antibiotics, then we want you to get into the hospital in time to get some doses of your antibiotics. And we usually give them every 4 to 6 hours. So You're going to have to account that. Now, if it's your first baby and your water breaks and nothing's happening, you've got time. If it's your second baby and your water breaks, you probably should go in because it's going to go quicker. But typically, what I tell my first-time moms is you don't need to go into the hospital until you hit a contraction rule. So if your water is not broken, then your contraction rule for a first-time mom is you're contracting every 4 minutes. Each contraction is lasting 60 to 90 seconds. None of those little putzers, right? None of those little 10, 15, 20-second contractions. Like good, solid, strong contractions, 60 to 90 seconds. And that goes on for 2 hours. Then you're going to head into the hospital. There's a lot of guesswork in pregnancy. You don't want to be in a lot of pain. You don't want to tear. Who does? You really don't care what your cousin's sister-in-law's friend Sally did for her birth. You want to choose your path. So jump into our weekly pregnancy updates and grab your free pregnancy and postpartum bundle checklist now and get all the details you need to know. We're going to help you stay organized during each trimester of pregnancy. There's no need to get overwhelmed and frustrated with all the suggestions that are out there. Do not Google search. We've helped you take the guesswork out of everything that needs to get done before the baby comes. Discover what all moms need to know to be ready for each trimester, the pre-birth mystery, and postpartum preparation. Plus, you'll be ready for each stage with the weekly education that we're going to send you. Get instant access now. The link is in the show notes. If your water broke and you are establishing a labor pattern, you could go in a little bit sooner. And as always, I tell all my girls inside of my private community, you listen to your gut. It is really important that you begin to listen to that mom instinct that you have. So I've had a couple students whose water broken or they've gone into labor and they have not hit their labor pattern rules that Trish gave them, but something inside of them is like, okay, something's happening now. I know this is the sign of this, and I feel a little farther along, even though my labor pattern is not according to rules. And they decide to go in, and it's a good decision. So don't negate your instinct or your gut or what your mind is telling you. Now, separate that from your fear. So I'm not talking about if you're like, oh my God, what if I don't get in? What if this? And then you start deciding you need to go in. I'm talking about through a calm, confident mindset that you're like, I've learned this and this about labor. And even though my contraction pattern doesn't line up with that, I'm feeling some things that I think I'm farther in my labor than my contractions are telling me. Listen to your gut and go in. We can always send you home. If your water is broke, we probably won't, but okay, so for those of you who are GBS positive, I want you to double the contraction rule. So if I'm saying for a first-time mom whose water has broken, she's going to head in when she's a little bit more than that 4-1-2 rule. So maybe at 6 to 8, 1-2. So less than 6 to 8 minutes, lasting 1 minute or more for 2 hours. If your water broke, everything's good. You're not GBS positive. You're going to want to go in. Okay, just because it can change quick once your water is broken. Now, for those of you who are GBS positive and it's your first baby, then you might want to head in when you're like at 10 to 15 minutes apart for 60 to 90 seconds each contraction for 1 hour. And that'll give you time to get a couple doses in if you're deciding to get treatment. Because I know some of you guys are rebels and you're not deciding to get antibiotics. And you know that my team and I met today about our mama membership because we just opened up our mama community. We've got 800 students in there. We do weekly coaching, monthly workshops from trying to conceive all the way to 1 year postpartum. We have prenatal yoga instructor. We have a postpartum life coach. We've got baby massage instructor, all sorts of things going on in the membership. And we decided to open it up to the public. So we met today and we were talking about our pillars and our goal for our moms. And our main goal inside of Labor Nurse Mama's membership is we want to embrace all of you and encourage you in your choices. We don't want to force you into any choices. So if you want an epidural, girl, that's your choice. If you want to vaccinate, that's your choice. If you don't want to vaccinate, that's your choice. We're going to educate you. And one of my students said, we lay it out and then you pick and you choose what is for you in your motherhood journey. You own it. So that is just a little blurb about what to do if your water breaks. Now, typically, for most of us, our water is going to break in transition, not in early labor. That is the most norm. But for some people, your water breaks earlier, and it's okay either way. What do I want you to know about having your water broken? So that's called artificial rupture of membranes. So what I want to tell you and what I tell my girls is that don't have your water broken. The studies have shown that it only shortens your labor by about 30 minutes, but it starts a time clock because once your water breaks, that bag of water is protecting the inside of the uterus and the amniotic fluid. So once that seal is broken, once it's open, then it's open to the possibility of infection. And infection will usually set in after that first 24 hours, if it's going to. It doesn't always. And just because you hit 24 hours from the time that it broke does not mean that you have to rush to the OR for cesarean. But we like to see you delivered before then. So if you have a choice, if your provider is saying, I want to break your water, I always say no. The bag of water cushions your baby from the pressure of the contractions. It allows the baby just a little comfort, and it protects the baby from the outside world and from infections. So what I teach my students is if you want to have your water broken, don't do it until you're in active labor. Active labor by standard is after 6 centimeters and regular consistent contractions and cervical change. So if none of that is happening, girl, do not have your water broken because you're just starting a clock and you're giving the baby less cushion during those contractions. If you are in an established pattern, you're past 6 centimeters and things are trucking along, then it's really up to you. But again, it cushions the baby and it's less likelihood for fetal deceleration. So again, anybody has any questions, as always, you guys can send a DM on Instagram, send us an email. If you're interested in joining our Mama membership, there's a link in my bio. It's a little wonky looking because this girl set it up and I am terrible with tech. The thing in my community is that Trish can deliver your baby, but not a link. So you can always just jump into the DMs, ask us about the Mama membership, and we'll be happy to answer your questions. We've got our next Fearless Birth Experience. We've got 5 incredible workshops. Send us a DM, put in Fearless Birth, and we'll send you all the information and get you signed up. Once you sign up, you're going to go to our pop-up Facebook group. You have to be a part of the Facebook group. That's where the magic happens. And you can get a little taste of our community. And we're going to do all the live teaching inside of there. We're talking all about the pain of labor. We're talking about why I coach my students and my mamas not to be afraid to embrace it, to work with their body, not against it. And then we're teaching all about postpartum prep, what to expect in those first couple days after baby. Then we're going to teach all about what happens when baby's born. Like, what are your decisions you have to make, those initial parenting decisions, medications, assessments, and tests that we do on baby. Then we're talking about pain coping techniques and pushing techniques. So 5 amazing workshops for you guys. They're all free. You can sign up at labornursemama.com/fearless, or you can comment on any of my posts, Fearless Birth, or a DM, Fearless Birth, and you'll get all the information. All right, you guys, thank you so much. You guys make me feel so amazing. I am passionate about educating women and just helping you to embrace your motherhood journey. I think it's so important that we as women surround one another with confident, calm education and support and no judgment. So that's one thing. If you're thinking about joining our membership and you're the type of mama who doesn't support your sister, then you probably don't want to be inside of our community because there is no mom shaming. There's no coming in and questioning another mom's decision. Now, you can come in and share what you did and how you did it, but not in a way that would shame a new mama, because we are so shaky in that first year and that first journey as mom that we want to support support you and enable you to make the right decisions for your family, because each of us are so uniquely different. So that's a really important pillar in our Mama membership and in our student community. Come, let me see your face. Let me see how you're doing. If you're one of my students, come. If you've delivered already, come and hang out with us. We want to hear your birth stories. We want to support you. If you're super tired, if you have the baby on your boob, we don't care. Come as you are. There's no judgment. Then Monday, we have our VBAC happy hour hangout. And Wednesday, we have our pregnancy happy hour hangout. So if you join the membership today, you get 7 days free and you can come to all of them that apply. And we've got workshops coming up that are pretty incredible. We have a pediatrician coming who is going to answer all your questions about having a newborn or a baby during cold and flu season and in the winter. So you can come and you can ask her questions. Hey Mama, I hope you enjoyed this little shorty about your water breaking. As always, hit subscribe, give us a review, and tell us how much you loved this episode and what you want to hear in the future. All right, I'll see you next Friday. Bye for now.